All right. So there are a lot of different birth professions. Of course, we have the very medical portion of it, which will be like your OBGYN, the midwife, labor and delivery nurse, neonatal specialist, uh, advanced maternal fetal specialist. So an OBGYN is someone that has completed a bachelor's, typically in the US, right? Someone that has completed a bachelor's degree, has gone on to med school, and then has additional training within obstetrics and gynecology specific. Um, there's also like a layer above this, which would be an advanced maternal fetal specialist. And so they have that training as well as an additional fellowship that specializes in typically like high risk pregnancies and deliveries. A labor and delivery nurse typically works in a hospital and they're registered nurses. And so they will have the certification and license for that. And then they do additional training to focus on the mother and baby unit, a neonatal specialist. They are um, typically, there's some that are like nurses, right? And so there are RNs that have taken additional training to become specialized in infants and newborns. There's also midwives who are specialists in birth. So OBGYNs are specialists in birth, and but they're surgeons, right? So they lead with being surgeons that are um, functional in women's health issues. Midwives are not surgeons; they are trained birth specialists, and so they typically will manage like um, low risk births. And so, in some like in the U.S., OBGYNs are the primary birth attendants for most births. In other countries, midwives are the primary birth attendants, and then OBGYNs are only called in for high risk cases. And so, the US is a little bit different in regards to how birth is centered in regards to professionals in other parts of the world. And so there's also birth attendants and birth assistants. And so a lot of times these are also working um, within, like alongside midwives. You don't see them as much in hospital based like settings, but they, are usually, they're not like nurses, but they are specialists in birth as well. And they support the primary care provider. And that can be things like taking temperature, like taking all the vital signs, but then also assisting the medical staff in attending the birth. So those are the primary medical birth professions. There's also non-medical birth professions, which would be um, companions, right? Like birth coach, birth companion, which would also be called like a doula. There's birth doulas, there are postpartum doulas, there are also abortion doulas, pregnancy and infant loss specialists. Sometimes we call this also a bereavement doula. There's also fertility doulas. And so a doula is essentially just a companion. A support person that is, that's a trained professional for these different stages of life in women's health. And so we'll do a little bit more of a deep dive into what a birth doula is. We'll touch also on what a postpartum doula is. These are the main, in regards to birth support, these are kind of the two main categories of birth professionals that are non medical. Some doulas are full spectrum, which might also mean that they cover fertility care, birth, postpartum, right? And so they cover all of those. Some cover even abortion and loss, and they have all these different trainings that are kind of like all in one. Um, and so although these are trained professionals, many that have like certifications, this is a certification that is not regulated by the state or the federal government. And so these are kind of self-regulating professions. And so a lot of times it's individual organizations that have their certifications and they have their own criteria. And these are not regulated at the state level. So someone can be a certified and trained doula. They could also be someone else could be like a community doula. They both tend to work in the same place and with the same, clientele. It's just a matter of um, the certification maybe being more marketable than a community doula, right? So we'll talk about certification and why it matters and why it doesn't a little bit later on, inshallah. Um, and so there's also lactation support, which is a big part of birth work as well. There are different stages of lactation support, like an IBCLC essentially has a master's degree in human feeding, in breastfeeding. And so they're the higher level of lactation support. There's also and I'm sorry, I said IBCLC is International Board Certified Lactation Consultant. There are also lactation educators. There's peer lactation educators. And so something like getting training at La Leche League, for example, in regards to how to breastfeed, latch support, um, feeding schedules and things to kind of like help increase, like milk supply, those kinds of things. That would be the lower level of peer lactation educator. Whereas like the upper level would be all of those things, but also the clinical roles of lactation support. Like, does mom have the breast tissue that's necessary to actually feed a baby? Is there an assessment for like a tongue tie or a lip tie that the baby needs? If there's like a breast and mouth like incompatibility, then they can help to assess for that. They can recommend other therapies that might be helpful in that. If there are issues such as mastitis, or clogged ducts, then an IBCLC can do assessments for that and make, guidance and recommendations based on that. And so those are hands-on aspects of support that lower level, like peer lactation educators, do not have. And so they take on more of a clinical role, advanced lactation support than a peer lactation or lactation educator would have. So there's also newborn care, right? And so this can be a newborn care specialist, right? Sometimes when people are holding a baby, changing a diaper, it's for their own baby for the very first time. And so a newborn care specialist has those skills that are, to help new parents say, like, how do you bathe the baby? How do you change a diaper? How do you take care of the umbilical cord while it's healing, right? With help with identifying skincare things like they're peeling skin or baby acne, cradle cap, those kinds of things. And so they can help parents in that way. They also help with sometimes with sleep training or how to burp a baby, those kinds of things. So it's pretty much like all the basics of taking care of a baby. These people are specialists in that care. There are also other things like with a sleep consultant to help with training for sleep issues and schedules and those kinds of things. There are baby wearing specialists. Like sometimes people want to do baby wraps and slings and need a little bit of guidance in that. There are some people that have gone and gotten certain trainings specifically for that, and sometimes a wide variety of baby wearing and what that could look like and what might be helpful for one person versus another, and kind of help them to navigate the different types of wears that they can consider and why. Of course, there's also infant massage. And so this might be just overall infant massage for different muscle imbalances, which a lot of babies have. This could also be infant massage for if they have like issues within their jaw that's preventing them from latching well. This could also be for digestive issues. Sometimes babies might be prone to constipation, and it might need a massage to help out with that. And so there are infant massage educators. Sometimes they're teaching the parents like how to do these things at home, and then there are also people that are actual massage therapists that have taken up additional specialties with babies and babies and children, and so those are typically licensed massage therapists that have gotten additional training for this specialty. Okay. um, There are other types of professions like pelvic health and body work. So this could be a pelvic floor therapist. Those are typically physical therapists that are already qualified and licensed to be physical therapists, and then they get additional training to become to become pelvic floor therapists. These are incredibly useful for pregnant people and postpartum people, because the pelvic floor really does, it takes on a lot during the process of birth and the postpartum period. So as a doula, this is also often a therapy that I refer people out to. Although I am trained at a lower level of like functional core and pelvic floor support, sometimes people need a specialist within the community, within the Muslim community specifically. Sometimes there are things like vaginismus, which is, a condition of the pelvic floor where the muscles are like overly tight, and going to the bathroom sometimes is painful. Sometimes, being intimate is painful. This is as much an anxiety disorder as it is like a physical, disorder, and they go hand in hand. And so, a pelvic floor specialist can be incredibly helpful in resolving issues like that. Whereas, like an OBGYN probably doesn't have a lot of the skills that are necessary to help with that, and a regular physical therapist probably doesn't have a lot of the skills that are necessary to help with that. And so, having someone that is concentrated like in this field to help the body to heal and balance and restore is incredibly helpful. So that is one profession. So it does require, physical therapists usually have, a bachelor's degree in something. They typically go to physical therapy training in school, which is kind of like a master's degree in physical therapy. And then this is an additional training like on top of that. So they are heavily licensed, heavily regulated professionals. So there's prenatal and postnatal yoga. So some people are already yoga instructors. They get additional training to specialize in pregnant and postpartum bodies. There's other aspects of body work like massage therapists that have gotten additional training to work with pregnant and postpartum bodies. There's training like spinning babies, which is different techniques and exercises and activities to essentially get baby in a good position and prepare baby for birth. This is a great alternative to an ECV, which is essentially like manually moving and manipulating a baby to put them in position, especially if baby is breech. So spinning babies can be very helpful in that. The closing the bones, which is sometimes this is a cultural, almost a ceremony within itself to kind of help mom bring her body back together, especially like at the closing of the 40 days postpartum within Islamic tradition, within other cultures. There's this kind of like sacred time of postpartum that is, the first 40 days. Of course, US standards, we just say, 6 weeks, but, the closing of the bones is kind of like the commencement to the entrance to motherhood, the commencement of like the pregnancy and that immediate like postpartum. And so it's like really just but like, it's not just belly binding, it's full body binding. And some people get additional training in this and for the strategies, and then also for the cultural rituals of it as well. Um, the rebozo is typically from Hispanic and indigenous like cultures. And so it is encouraged that if you utilize these techniques, then to learn from someone who is trained with them, because it is a part of someone else's like culture that may or may not be your own, then to get the training like specifically from people that have the specialty and that understand the culture and the history that also comes along with that, and operate out of the space of awareness and sensitivity and cultural humility for the sacredness of the rebozo. And so there's additional training that comes along with that. Yoni steaming is vaginal steaming. There are different trainings, and there are a lot of different cultures that actually practice this, and each one has their own way. Sometimes it is with heat and steam and moisture. Sometimes it's a smoke bath. And so it just kind of like, or, with either um, like scented, like woods and those kinds of things. Sometimes it's just like charcoal and like in heat and like in different like herbs. And so there are different like ways to do the vaginal steaming. So when we say yoni steaming, it's not specific to like Indian vaginal steaming, for example, right? We just mean like vaginal steaming from a wide variety of techniques. And there are different certifications and specialties for that. Again, this is one of those things that isn't regulated by the state or, or by the federal government. And so all of these that we're considering here, body work, spinning baby, closing the bones rebozo. All of these are like self-regulated and self-certifying organizations and entities. So there's also chiropractic care, which is incredibly useful during, for pregnant and postpartum people. The bones get misaligned. Sometimes they just need that adjustment to get back to some type of balance. And so typically these are chiropractors that are already licensed, which is regulated by the state, and then they do additional training to work with pregnant and postpartum bodies. And so the same thing for massage therapists. And so there's typical massage therapy, and then there's also training to work with, pregnant and postpartum people. So that's also like regulated by the state. So there are other aspects of continuous care. Mental health surrounding pregnancy and postpartum is its own specialty. So these are typically licensed therapists that have taken on additional training to support pregnant and postpartum people. There's a wide range of mental health disorders. Most of the time, people think about um, postpartum depression, but there's also postpartum anxiety. There's also postpartum psychosis, right, which needs a higher level of training to be able to support people. Um, so there's perinatal mental health, like counselors, social workers sometimes also get additional trainings, to focus on perinatal mood disorders and things like that. And sometimes they're providing like resources and classes and workshops and things like that. Um, there's also education and advocacy, which is a big part of birth work as well. And so this can be childbirth education, right? The stages of pregnancy and how the baby is developing, the stages of birth, and all the levels that go along with that immediate postpartum, the long-term postpartum, what all that looks like. This is education, and a lot of times people have a certification for that. It's another one of those things that is not regulated by the state or by the government. And so typically, if you see something like ICEA, these are self-regulated courses, self-licensing, self-certified. And so they don't necessarily have regulations, like they don't have regulations by the state or government, like entities. They just kind of follow their own curriculum and have some freedom to do that. So there's Lamaze, there's the Bradley method. All of these are preparing the body for birth. Some of them are more emphasis on the dad as the support person, and kind of like dad's role in regards to supporting mom during the birth work. Some of these are kind of like just have a support person, have someone who's your educator, who's your advocate, and kind of to help fill in the gaps with that. There's a lot of different courses. Birthing from Within is a great course. Some of these can be like from the hospital itself. A lot of parents have access to education opportunities, childbirth education courses, dads, as a support person, kind of like preparing them to be birth partners. A lot of hospitals will have courses like available to people who are delivering at them. A lot of birth centers, and midwife practices will also have these kinds of courses. And so education is a really big part of birth work, because the more we know, the less fears we have. And so there are also courses and trainings that have more specialty within issues that we're currently facing. Like America is in, a maternal mortality crisis, right? And who tends to take the, like statistically, we know that like that Black women, for example, are at increased risk. Black women and Black babies are at increased risk for the risk of dying during birth, more so than their white counterparts. There's a lot of reasons that come into this, and it is like essentially recognizing that there's a lot of racism within our healthcare that impacts the birthing experiences of people. And so this isn't something that's exclusive to Black people. We know that people from all the full spectrum of marginalized communities are also facing a lot of racism and discrimination within healthcare, and that this also impacts their babies as well. So birth justice advocates, birth equity advocates, reproductive health educators all kind of take an emphasis on highlighting these things, especially reproductive, justice. And that includes not just birth, but even with reproductive health care, access to abortions, access to birth control, things like that, right? Um, so there's a pretty broad range within the specialty of education and advocacy that you can get a little bit further on. That there are advocates for birth justice, and that includes, for Black and Brown mothers, that includes for teenage parents, that includes people for the LGBTQIA, community, for immigrants, right? Like, so people that don't speak English as well. That there's also layers and layers and layers of biases within healthcare that impacts their birth experiences. And so advocacy and education is a really big part of it, in terms of how how people even feel towards their birth, even if mom and baby are fine. And so there are other things like community health workers, community birth educators, community doulas. There's perinatal like herbalists. There's traditional birth attendants, which might not have like any licensing, but sometimes they are specialists based on their culture, right? Like some cultures have very rich traditions in regards to pregnancy and birth and postpartum, with certain foods, with certain rituals and things like that. And so sometimes these traditional like birth attendants have their training, right, that they pass on to the next generation of trained birth workers that are kind of highlighting these rituals and traditions. All right. So we talked about a lot of different professions today. We're going to give a little bit more emphasis on doulas and what doulas do. There's a pretty broad range of doulas and what they do. There are birth doulas, and that's going to be somebody that supports, a person during before birth, during the pregnancy. Um, During the actual birth, during the immediate postpartum. There's also the antepartum doula, which these typically will help with, like, if a mom is on bed rest or if a mom is a high risk, pregnancy and can't do the things that she typically does, then, a doula that works within this space, like during pregnancy, to support the pregnant person. Just with sometimes with just like their day-to-day task. And so that this aspect of sometimes it's kind of like this is just a part of being like a doula in general. Sometimes it's considered to be like its own specialty, especially if these are doulas that work within a hospital setting and not working with a family at home. um, so there's also the postpartum doula, which is going to provide that newborn support, going to provide new parent guidance and instruction, and then also focus on the mother, right, and bringing her body back together, kind of helping her out with the anxieties and the education and information that's necessary right after having a baby. So this can be lactation support. This can be, helping with feeding schedules, and or even like using equipment, right? Like, how do you use a breast pump? How do you sterilize, bottles and those kinds of things as well. So it's a pretty broad range of the type of care that postpartum doulas provide. Um, we're also going to look at newborn care specialists, and these are just people that kind of focus on newborn, on everything, the full spectrum of newborn care, changing diapers, feeding, positioning, massage, what's normal for their developmental stages, kind of helping to overcome different like challenges, and just kind of operating from that lens. So there are within doulas, there's more people can become more and more specialized. A full spectrum doula is one that typically has the knowledge and the skills for the whole range of perinatal care, right? And that can include fertility, that can include birth, pregnancy, birth, postpartum, Sometimes this also includes grief and loss, but that's usually an additional training that sometimes people get. So, but typically a full spectrum doula is at the minimum going to cover fertility, pregnancy, birth, and postpartum. There's, loss and bereavement doula, which helps parents to just kind of navigate miscarriages and stillbirth. Um, and this, sometimes bereavement doulas also cover, abortion doulas because sometimes people have lost the baby and then they still have to have an abortion to, like they've lost the baby during their pregnancy, right? And then they have to have an abortion to remove the tissue, and so it's like there's some aspects of support for. The loss of the pregnancy like itself, and then other aspects of support for the procedures that come along with that, and then the follow-up. And so these are two different things, even though they overlap. And you'll see that a lot of doula care tends to overlap a lot because all these things are connected. Um, and so there's, abortion doulas and, just providing that non-judgmental, safe space support for people for whatever the reasons are that they are getting an abortion, including and especially for medical losses. So there's fertility doulas, right? Sometimes people need help navigating the process of actually becoming pregnant, and this can be for treatments, if people are receiving things like IVF, right? If people are, um, struggling to conceive, then it's like, that guidance of maybe here's some herbal remedies you can try. Maybe acupuncture is helpful. Here's a specialist, that has like a really good reputation. Those kinds of things. Also, coping with fertility issues as they come along. So it's providing that aspect of here's some resources, here's some education, but here's some support and some companionship along this journey as well. And so there's adoption doulas, surrogacy. So it's like essentially you'll kind of see this thing that doulas essentially just fill the gap, right? And that is with education, that's with support, that's with, with companionship, that is with gathering resources as well, because doulas don't know everything, but sometimes it's just a matter of being really resourceful. It's like, I don't know this, I don't have this information. I will find somebody that does, right? And just put that information in your hands. So a lot of it is that, you kind of see this recurring theme of the roles, and it's essentially just to fill the gaps for all these transitions that people need to take. So you can think of it as a support person, a coach, a companion for these different stages in life. But there's cultural and community doulas, sometimes with different practices, because just like these are really important transitions for people. You want to make sure that it's a good fit, that want to make sure that it's a good match, and that they're taking your needs, your traditions, your priorities, like into consideration as well. Um, and so there are also youth and teen doulas, right? Like sometimes young people, especially, young and unwed parents, for example, there's a series of challenges that they may have that an established, 30-year-old educated person may not have. And so sometimes people will take on the role of being a youth doula, specifically a teen, doula and advocate to help them kind of navigate the specific challenges like that they have. There are other doulas on the other end of the spectrum, right? And that includes the end of life care, helping families transition when it's very clear that someone is dying, sorry, helping them to navigate hospice care, helping them to make sure that their paperwork is taken care of, that their arrangements are made, that they spend the last of their days in, in peace as they transition. And so there are death doulas as well. There's additional trainings, for that. It's another one of those fields that is like self-regulating, and so they aren't licensed. And this is going to be the full range of like doulas, right? These aren't professions that are licensed at this point and regulated like by the state. It's up to the individual organizations that are certifying, and they have their own criteria for that. Um, So let's dig a little bit more into birth doulas and what that actually looks like. Again, birth doulas are non-medical support and provide a lot of educational support, emotional support, physical support, and spiritual support and uplifting, right? And so, because a lot of, and the reason why we have this is because a lot of people are really surprised at how little actual care and continuous care you get whenever you go and have a baby, right? And so it's kind of like, okay, if you are, you go to the hospital, you see the nurse, they do their paperwork, they check their vitals, they ask if you need anything, and then they're gone, right? The same thing with the doctor. They might come in and give you the information about where things are in regards to the process, if anything like needs to change in regards to the plan and like in the way that the birth is going. They might come in and actually do like, a cervical exam and kind of like update you in regards to where, the stage that things are in, and kind of like, a little bit of a heads up about like, the what's next. And then they're gone, right? And then we don't see them typically again until we are actively in the pushing stage. And so a lot of times people, think like the movies, right? That like, okay, once you go into labor, then your doctor comes and stays with you during the whole like birth process. Is not like that. And it's the same thing for the nurses. They have a lot of stuff to do. They have plenty of other, patients that they're attending to. And so a lot of times people are, it's them and their partner just in the hospital without a lot of information, without a lot of support. And so a doula steps into that space, right? And kind of fills in the gap. And so you typically will have that continuous support. So it's like if you are, at the hospital with, let's say, a labor that is like 12 hours, for example, you probably will have about, a couple of hours of sporadic support from the nurses. They're in and out, they're checking on you and kind of making their rounds. Once you go into the pushing stage is when they stay there continuously until baby is born. And then, once we're in the pushing stage is when they call the doctor in. And so the doctor, nurse might be there in and out maybe a total of like a couple of hours of that time. The doctor might be there in and out and probably, like an hour altogether if pushing goes really smoothly. And so so there isn't a lot of like continuous care, and so this is kind of where doulas like step in with that. So but again, doulas are support companions, they're coaches, they offer like guidance for this space. They do not replace the doctor, do not replace the midwife, do not replace the nurses. And so this is non-medical support for this stage. And so that's physical support, and that is like comfort measures, and that's coping skills, and that's saying like, hey, let's try this position, and see if baby tolerates this well. See if we can help baby, to come down. Sometimes that's, massage. Like I personally am a cupping therapist, and so I typically like to do massage like with my cups instead of my hands, just to kind of save my hands so that I can do counter pressure, for example, at a little bit later stage, of the birth process. And so, but some, doulas are very like, hands on. And then some are very hands off. This is one of those things where we kind of like let the person who's giving birth lead with that in regards to what it is that they need. Some people are just like, don't touch me, just be here, cheer me on. All right, you got it, right? And so there's the emotional support, right? And sometimes that's just a current like encouragement. Like here's the stages of labor that, here's the stage of labor that we're in. You got it. You can do it. Reminding them of their birth plan, being that calming, and just like steady presence, answering their questions. And then if you don't know, um, no, if you don't know something, then get that information like for them, right? And that's one of the most powerful things that we have is, being a doula is like we don't have to be experts in anything. We don't have to be experts in everything. Let me say, you don't have to be an expert in everything, but just to be able to get that information to provide that reassurance, like for the family. And so sometimes it's a matter of saying, like, I actually don't know that. That's a great question for your nurse. Let me go ahead and like and grab her, right? Or that's a great question to hold on to, and we can ask the doctor whenever he, like whenever he or she comes back. And so sometimes it's just a matter of making sure that they feel safe and comfortable enough to like to answer their questions, even if we can't answer them, to have their questions asked. even if we can't answer them like directly, right? Which does happen more than we probably would ever admit. And so, yeah, so there's, sometimes it's just the breathe, relax. You can do it. You got it. You're doing great, right? Being their absolute, like cheerleader. Sometimes it's just that reassurance of like, I know this is hard, but like you're doing amazing and everything is normal at this point, right? So if everything is going to to plan, then we don't need to make an adjustments. We need to just like understand this process, and we'll ride through that together, right? And so, and sometimes like clients don't have the words, to say, and they need support in that, right? And so the thing when it comes to advocacy is always that, that when we can empower somebody to use their own voice and use their own words, then we're absolutely doing that, right? Birth is just one of those experiences that tends to make people feel disempowered. And so it's like, we don't want to be one more person that is taking that away from them, right? And so it's a matter of like, if they feel like they can ask a question, if they feel like they can talk to their doctor, if they feel like they can, get more information, then go for it. If they don't feel that way, then it's a matter of how do we provide an environment that makes them feel safe to do so, right? How do we make sure that their wishes are being followed, and then and making sure that they're being heard and that they're being seen, and that they're being prioritized within their care. It's like we want it to be that people want to be active participants within their birth experiences and not just feeling like this is something that is happening to them, right? And so advocacy is a really big part of being a doula, and that's not just with doctors and and nurses. Sometimes that's also with even like family, right? Sometimes we have, especially within the Muslim community, where we have cultures where it's like, oh, somebody's in labor, everybody's coming to visit, even while mom is in labor. And it's like, that might be distracting to mom. Maybe she needs that space to say, I don't really want anybody here but my doula and my husband. And then we can kind of like step in that role of like maybe asking the family to leave and just give a little bit more time, right? And so so that aspect of advocacy is not just with other health professionals. It's for family and whatever it is to generate comfort, right? Comfort and safety for the person who is having a baby. And so doulas don't perform any medical tests, right? We don't do cervical exams. We don't do monitoring. We don't do any like diagnosis or any of those things. And so but we do like, explain these things to our clients, say, okay, this is a cervical exam. Here's what it is. Here's maybe what it feels like. Here's how we're going to get through it. Here's what it can tell us. Here's what it can't tell us. Right. And so sometimes it is just that aspect of like educational support for the procedures and the interventions, like as they are happening. So doulas don't make medical decisions for their clients, don't make any decisions for their clients. Our role is to make sure that the client is making decisions for themselves and that they're making those decisions with information, right? With evidence-based information, and that they aren't making those decisions like based out of fear. So it's not a replacement for medical care, and it's not speaking for a client. It's encouraging and empowering them to speak for themselves.